Welcome back to OET's Prep Talks. In today's session, I'm going to discuss with you why we have listening part A for OET's listening subtest, and we are also going to look at a particular skill that's going to enhance your listening skills. But before we get started, I want you to look at the image on the screen and think of a few words or all the thoughts that come to your mind when you look at this image. Now, as you've seen, depending on whether you have been a surgeon or a perioperative nurse or someone closely taking part in a surgical procedure, or you have not been closely associated with surgeries, but you have been working in the hospital, or if you have just been a patient who had undergone a surgery, the vocabulary you would have typed in varies. But still, the image of the operating room, the operating theater, has triggered a lot of vocabulary in your brain. And this is the power of anticipation. So when you look at listening part A, when you take up a listening part A task, I want you to be able to anticipate what could come in the conversation. And to help you to anticipate, in part A listening, you do have a lot of other words, including relevant words or keywords, which is part of the gap fill. So that's really going to help you. So you're going to look at a few examples that will help you. Now on the screen you have a part of a part A listening extract. From the heading, you read that you can identify that you're listening to a conversation between Dr. Greg with a patient who has migraine. And the heading also says reason for visit, severe headache. Now, can you anticipate a lot of vocabulary that might come up in the discussion with the GP? Please type in all your words, all the vocabulary that you can think of. Now let's look at questions 1 to 4. The first question says, dash or blank patches in vision. So you have one of the aspects that has affected the patient's vision, but one is a gap for you to fill in. So something closely related to blank patches is what you're going to fill in. Think of what all could be possible answers, and that's what anticipation is all about. It's about predicting the content with a relation to the rest of the content which is already given. Now, as you find your answers, please type in, and let's look at the other 3 as well, which we are covering in today's example. Now the second one is about something that's throbbing and has been persisting for the last for a few days. So what could have been the throbbing gap? Try to anticipate. Thirdly, some sort of sensation, a dash sensation that is non-productive. Now that's pretty direct. We talk of something that is productive and non-productive, so you could quickly anticipate and fill in even before you listen to the extract. And finally, you have a gap and ibuprofen and vitamin tablets. So you have 2 medications in the question and one is missing. So when you listen to the name of any medicine, when you listen to the name of any medication, I want you to be able to quickly identify, because you know what you are looking for. All right, so since you have been able to predict or closely predict the answers for these examples, I hope you would have understood what anticipation is all about and how much it's going to help you in your listening part A. Now, all of this happened even before you actually listened to the extract. Now, when you do the test, when you have already tried to anticipate and then you complete the gaps listening to the audio extract, it would be far more easier, because in your brain, what you have already anticipated will help you to link with the real answers, which could be closely related to the words in the question. So that's what makes it really helpful for you in listening subtest. I hope this lesson was really helpful for you. For more lessons and alerts, subscribe and click on the notification icon. I hope you'll have a lot of great lessons and fun learning. Thank you for watching.